Okay. This, I thought it was like, when I was a student, even when I was like starting as a clinician, people tell you to breathe and relax. Like that would set me off. Like someone telling you to like breathe and relax is an instant way of me to like lose my mind. That being said, the education on proper breathing mechanics and how variable breathing mechanics can influence your nervous system, like we got to talk about. So there, with breathing, you might see this. You might see this in a lot of different conditions, but some individuals who come in have this like paroxysmal breathing pattern where they're going to be like they have that, like their chest expands, their stomach sinks in, and they're just like taking those really shallow chest breaths. That is essentially simulating like a high intensity activity, and as a result their sympathetic nervous system is firing and things are becoming like wired to just be like things are going wrong for me. As a result, you're going to get a lot of tension through all these muscles up in your neck and your shoulders, all over your ribs. So this is actually something I use almost always as a home exercise. Not always. It depends. As we know, it depends. But almost always with like the first day as a home exercise program with my individuals with chronic pain. I will just go through the importance of appropriate diaphragmatic breathing and then different styles of it. So there's a lot of different, there's like, I'm sure you guys have seen like different number schemes with breathing, like in terms of the inhale, sustain, hold, and an exhale. This is probably the more commonly prescribed like nowadays. There were some studies, actually very recently, that looked at this, and this was like one of the optimal ways to stimulate parasympathetic response while relaxing sympathetic response. So everyone try this. We're gonna do 4, 7, 8 breathing. Hopefully no one starts like hyperventilating while doing this. If you've never done it, it's actually a lot harder than it seems. I'm gonna describe it first so no one's just holding their breath. You're gonna place the tip of your tongue against the ridge of your teeth, like right behind your teeth, like that. And then you're gonna close your mouth. You're gonna inhale quietly through your nose for a count of 4. That being said, it's quiet, but you're gonna try to get as much air in through your nose as possible. Okay, that's the only way this really works. Then you're gonna hold your breath for 7 seconds, and then you're gonna exhale for 8 seconds. Okay, so 4 seconds in, as much air as you can, 7-second hold, 8 seconds, you're gonna go out. As you're going out, you're gonna go, that little like whoosh sound. All right, you guys wanna try it? So I'm not gonna do it, I'll actually talk. So let's get a clock. We'll do this right. Ready? Everyone start breathing in. Hold your breath. Exhale. Breathe in. Hold your breath. Exhale. And relax, back to your normal breathing. Who did it right the first time? Good, good. First time I did it, I was like, it was easy, and then like I ran out of breath after like 3 seconds, like breathing out. I was like, oh god! So it definitely need to learn how to relax. So this is something great. Like people love it because you're giving them an exercise that is just breathing. Like you tell them this is something that's going to help you. This is something that can potentially really make a big difference. I want you to set a timer, like do 2 to 3 minutes while you're watching TV. When a commercial comes on, because apparently people still watch TV with commercials. Like when a commercial comes on, like just do it while the commercial's on. And this makes a big difference, and it's really cool when people come in and they're like, I did an exercise, I worked on my breathing, as the person who's doing like, like really, really tough like physical exercises. It's like, damn, that's so much better. But it is a really cool thing to give people, and again, it does make a big difference. And this alone has just helped so much with reducing that baseline pain with a lot of individuals. So this is like a first day type thing usually. Yeah.
So you say they kind of do it during the commercials. Is there a frequency per day that is kind of prescribed that you recommend?
Good question. So from an evidence-based standpoint, I'm not familiar with any like set variables. That being said, this is something where, because it does help restore typical breathing patterns, especially with like the diaphragmatic breathing, I do encourage them to do like up to like every hour or so. Like even if they spend like a minute or two every hour, especially if they're like at work or something, and like take a break from work, like take a minute or two and then just work on it, that typically helps quite a bit for me. But I don't have a good like evidence-based answer. That's typically what I help give, just because it's essentially like motor reprogramming. So.
I think Andrew Weil developed it. And
Okay.
He said 4 to 8 reps a day to start.
Really?
Yeah, he said it's too powerful for most people to handle.
That sounds like something, yeah. Okay. Too powerful.
But that's how
Interesting.
he always described it.
Interesting. Yeah, this is great. I like it a lot. So, cool.
So what's the positive effects? So you say that the lion will start leaving the room?
The response. So you're getting that parasympathetic stimulation. So you're getting that calming impact. You're trying to turn down that alarm system. Ideally, what it does is it's restoring their more natural, neutral breathing mechanics. It should help alleviate some of the more obvious physical factors, whether we're talking tension in the neck, tension in a lot of the supplementary like breathing muscles that shouldn't be utilized as your primary breathing source, as well as just psychologically, just calming things, like setting down that alarm system, turning it down a little bit. Again, it's something that like, this is hard. Like this is actually really hard if you're not in tune with your body. Like we all did it, I think, fairly easy. We all also do this for a living. Like this is something where patients come in and like they'll try, and they'll do it in 2 seconds. Like they'll inhale 2 seconds and they're like, I can't do anymore. And Nick, I think that's actually a great point you brought up.
I think that's more.
That's a really good point you brought up. Yeah, like for some people it might just be too much at first, and just scale it accordingly.
So if you had someone and you started this pretty early on
Yep.
in their treatment, and you kind of consistently do it for a while, if they get good at it to a point, could you consider doing it on top of like an exercise that causes them a lot of pain usually?
Sure. Yeah, especially if it's an exercise that doesn't require like significant amounts of like force production, because then we're going into like Valsalva versus like appropriate breathing mechanics or things like that. But yeah, absolutely. And this is like something where like if someone comes in, you gotta know the patient when you're saying this, but if someone comes in and they're like, oh, like it's a really bad day, this is happening, you know, like before you actually ask anything at all, they're giving you their whole like, all these bad things happen. I'm like, I need you to breathe. I'm setting the timer for 2 minutes and then talk to me. And then they come in and they're like, I find I'm better. Like, it's a good way to just refocus as well. So I use it a little bit as a like a little backdoor cognitive therapy tool as well. Okay? So that's breathing. So there are 2 things that on here that I personally have not utilized a lot. And then working with some clinicians, I work with 2 pelvic floor therapists who are fantastic. And I feel like we both do it amazes me that we're both physical therapists because our days cannot be more different. But that being said, they utilize biofeedback a lot. This is something that I've had pretty much no experience doing myself until very recently. There are a lot of different ways to utilize biofeedback. Biofeedback, the process is basically teaching voluntary influence over physiological variables that can cause or respond to chronic pain. The whole goal is to make people more aware of what they are doing primarily at rest, but also with activities, okay? So for this, like, I know they utilize it quite a bit with individuals who have like overactive abdominal muscles at all times that might be causing some issues with like pelvic floor. They use surface level EMGs essentially. So they use electrodes that look just like your stim pads. And they give you baseline levels of muscle activity, and it'll give you values, okay? I have no idea what the values actually are. I'll say 8, because 8 seems like a good number. 8 units. They'll say normalized value at rest should be 1 to 3. And they'll try different techniques with their patients to try to calm these muscles down. Whether they're utilizing some of the breathing strategies, whether they're using some exercise, some movement, whether they work on fatiguing the muscle and then doing it again. They utilize biofeedback pretty darn effectively. So this is something that I've recently been trying with like a select few pilot study of my patients. I am not personally good at it yet. But it has been something like where patients really do get that like objective view of what's going on. Because it's easy to like look at somebody and be like, you're tense, loosen up. And they're like, I am loose. You're like, you're not loose at all. Like, dude, you gotta like relax. This literally gives them something to look at. And they're like, oh, like, hey, now I'm loose, like now I feel better. So this works really well, and I want to personally utilize it in a more skillful fashion for individuals who need that like objective value to help them bring things down. So again, there's other methods, but the surface level EMG I feel like is probably the most widely used for PTs at least. And then this is the second thing that I utilize quite a bit with individuals who are status post amputations, but I haven't really utilized much with chronic pain. And the research out there is increasingly good, but graded motor imagery. So this is referring to a very specific process of motor imagery. It's not just like visualize yourself succeeding. Like, this is a very stepwise system. It's all exercises aimed at addressing cortical changes associated with pain and movement dysfunction. So there are 3 major steps. You have laterality training first, and it is recommended that you do this in a stepwise fashion. Okay? You have laterality training. This is where you're going to make sure your patient knows how to discern left from right movements. With the research, it shows that you have to show individuals like pictures, videos, you can show them yourself of just certain movements pertaining to their areas of pain and some of the associated areas around. So you might show them, like let's say there's somebody who has like significant hand pain, okay? You might start by showing them the elbow, and you're gonna show a picture and be like, this is an elbow, which side of the body is that elbow on? Which movement? Is it bent or is it straight? You're gonna do this with a whole different bunch of pictures. The idea is that they are associating like anatomically accurate and physiologically grounded like ideas about this. This is something that sounds crazy, and again, this is something that I am not by any means an expert in like doing myself in the clinic yet. I work with individuals who do it, and it's pretty awesome. But basically showing pictures like, is this your left hand? Is this your right hand? Is this flexion? Is this extension? If it's their back that's giving them issues, you might say like, are they rotating to the right? Are they rotating to the left? It's just getting them in tune with how a body should move, okay? Then you're gonna do explicit motor imagery. So for this, you're basically trying to get them visualizing specific movements. So you're gonna say like, I want you to picture picking up that step stool with your right arm. I want you to picture your hand gripping the step stool handle. I want you to picture lifting it up with your right hand, switching it to your left hand, and then putting the step stool down. So you're giving them direct, explicit motor imagery, basically to try to create that picture. Like it's kind of like if you're in sports and you learn like a new technique or something, and you like go home and you're like, I know we did this, I know we did that, like running that through your mind. It's the same idea essentially, you're just trying to guide them on a path. So it's like bringing them on a little mental adventure, but you're giving them every step of the way. And then the last part, this is the part that like, I don't do, and I should, but it's the mirror therapy. So they say that you should use this as the third part of this treatment. You can use a little like handheld mirror, you block it off. We've all probably seen this for individuals who are amputees or things like that. I've used this for individuals who are amputees and limb loss for like phantom pain and things. But there is some research showing that it's effective for individuals with chronic pain as well. And basically you're gonna block, if this was a mirror, I would block it off so I actually can't see this arm. Okay, this is the side, let's say I have chronic pain, or the side that I have worse pain, okay? And then everything I do, I'm actually gonna do on my right side, it's gonna mirror onto this. And then the idea is that by watching this side move, I think the science has to do with like mirror neurons in each periphery, you should be able to reduce the overall sensitivity of this limb as well as your own personal awareness of what's going on. So again, that's something that, in terms of like all the options available, I personally have not utilized a lot in the clinic with individuals with chronic pain. I think it works very well with individuals who do have phantom limb pain and things like that. but the research is pretty darn good looking at this. So it's something I'm hoping to utilize a little bit more. So those were the two that I don't actively utilize too much, but I'm hoping to in the future.